Greetings, pharmacology students, and welcome to week 7. You have several chapters. I'm actually going to emphasize a few and cross out at least one. And then you just have your week 7 quiz. So there's nothing extra for you to do this week. So according to our course schedule, we're going back to the front of the book. We're going to talk about anti-infective, anti-inflammatory medications. There's a chapter 7, that is Introduction to Cell Physiology. I'm going to tell you that what I want you to concentrate, that's very heavy, lots of patho, or maybe more biology, I would say, in this chapter. But what I want you to concentrate on in chapter 7 is the characteristics of the cell membrane. You'll see all these other terms about the Golgi bodies and the this and the that inside the cell. I want you to focus on the cell membrane because cell membrane permeability is the essence of basically the inflammatory process. It's a big player, and also how do these medications work? How do they get into the cell? So the characteristics of the cell membrane are important as we proceed through this whole chapter basically about anti-infective medications. So once you've got a good grasp of the cell membrane, refresh yourself on homeostasis of the cell and the way substances move in and out of the cell, the passive transport, which basically is osmosis and diffusion, and then the active transport, which of course requires energy because you've got substances moving against an area of concentration. So it requires energy to do that. It's the opposite of basically what passive transport is. Look on page 82, we'll have a nice discussion of homeostasis. And that's it for chapter 7. Moving right on to chapter 8. Chapter 8 is called Anti-Infective Agents. And chapter 8 is really an overview of the next following chapters, which break down all these anti-infective agents into classification. Those that work against bacteria, those that work against viruses, those that work against fungus and protozoa, etc. You could say, I'm going to skip that chapter, that's the overview, and I'm just going to go right to the individual chapters. Don't do that. Spend some time on this chapter 8. In your glossary for chapter 8, refresh your memory or learn what is the definition of superinfection. Also read about selective toxicity. Selective toxicity, this is a property of the anti-infective itself, and realize that not all of these medications even possess this selective toxicity. That's why we get into trouble. And that's why sometimes in the hospital when a patient has a complex infection or a resistant infection, we actually call in another specialist called the infectious disease doctor or the ID doctor. I always loved it when an ID doctor came on because it gave me an extra layer of confidence. This is someone who did extra work, fellowships, etc., extra time in medical school, focusing on infections and the medications that we use to knock them out. Versus the hospitalists are awesome, but the hospitalists are more generalist. You could have a hospitalist who, for instance, last week called in an infectious disease doctor on his patient, and he ordered this, this, and this. So that doctor could mistakenly think, oh, here's another patient with this, I'm going to order that same thing, without realizing that every patient is different. That's why we have to have respect for these antibiotics. And we'll talk more about how people get into trouble using antibiotics or misusing them. And we'll also talk about how bacteria has over time developed resistance. And it's a very scary time in the world of infection. If you ever run into an infection control nurse in the hospital and have some time to chat with them about if they've been in that position for a number of years, how things have changed. Really, the focus now is all about how do we deal with resistant infections, because there are some disorders out there that there are basically no antibiotics that have proven effective. There's it came from Canada, a C. diff, Clostridium difficile strain from, I think it was called North American blah, 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 blah. Anyway, it came from Canada. There is no medication that is helpful or that is effective against this particular strain. And so a patient who is diagnosed with that after they fail all these other trials with various medications, the only thing that they're left with is having a total resection of their bowel. Their bowel just has to be taken out because there is no treatment for it. So how can we as healthcare professionals help educate our patients to not be so demanding about antibiotics, for instance, when they go to urgent care or when they go to their primary physician? And how can we help our patients understand that it is using antibiotics in the prescribed way that will most benefit them for now and in the future? So also in this chapter, this overview chapter, look at the differentiation between broad spectrum and narrow spectrum drugs. And they are just as they sound. The broad spectrum antibiotics, you're throwing out a big net. You're throwing out this antibiotic that may work here, may work there, may work there. That could be part of the problem that we're facing. Also, the characteristics of some antibiotics, the differences between the terms bacteriostatic and bactericidal. Bacteriostatic is a property that will stop bacterial growth. Bactericidal is the property that will actually kill. Cidal, so think it's C-I-D-A-L, so think of suicide or homicide. Bactericidal will actually kill the bacteria. Also in this chapter, you're going to read about bacterial resistance, as I said, bacterial resistance and then acquired resistance, and discuss how anti-infective resistance is developed. So read about the process that leaves a patient with a resistant infection. On page 89, there's, I think it's a box called Therapeutic Actions of Classes. So this is an overview of the chapters to come as it breaks down the different classes of, I call them antibiotics, but the terminology in this chapter is anti-infectives. The only drug I'm going to ask you to look up for this chapter is vancomycin. There's a little discussion of vancomycin. I think vancomycin is a aminoglycoside drug, but for some reason they don't talk about it in the next chapter on antibiotics. In this chapter on anti-infectives, they do discuss vancomycin as a pretty dangerous drug, and they give you the idea that it's not used very often. That's not what I find. Vancomycin is extremely popular, and yes, it is dangerous in that, let's just say there's lots of considerations to be considered when you're giving a patient vancomycin. So for these drugs I'm going to mention as we go through these chapters, I'm encouraging you to go to the Lippincott Advisor. Remember, on the home page in Lippincott for your course, if you say course content right in the middle there, it says Lippincott Advisor, and then you open that up and then click on drugs. And then you'll find a whole profile of each of these medications that I'm referring to. And I really think for this week, this is a time where you need to make yourself a table of these various drugs, because when it comes to quiz questions or test questions, you'll see that the question may be about the class of antibiotic, or it may be about a specific antibiotic. And again, you'll see a lot of the patient education is very similar, but they all do different things. Some of them interfere with protein synthesis. Some of them interfere with DNA synthesis. And then some of them affect the cell membrane, as I was saying, the actual wall. Some of them work in conjunction. So you give one antibiotic to break down the cell wall and to allow this other to enter the cell. So it's a very complex, I would say this chapter, actually, the chapter on antibiotics, which is chapter 9, the next chapter, that's where the meat and potatoes is of this week, because that's where the most clinically relevant information lies when it talks about all these various classifications of antibiotics. Again, in this anti-infective chapter 8, it'll teach you about culture and sensitivity. So obviously when a patient has a urinary tract infection, a respiratory, so we get a sample of urine and run it for a culture. They have a respiratory infection, we're going to ask them to cough sputum, and we send it for a culture. We're not only interested in what is growing, what organism is growing, but we also want to know what is this organism sensitive to. We call it culture and sensitivity, or CNS. C and the sign for and S. Culture and sensitivity. What is this organism sensitive to? In many cases, it'll be sensitive to 5, 6, 7, 8. Okay, but then we want to know which of these antibiotics can we give the least amount of in order for it to be effective, to kill this organism. Because as you read through these different classes and see all of the adverse effects that these antibiotics can cause, you'll see this is why we only want to give the patient we want to give them the least amount to be most effective. And that's what the sensitivity report gives us. So you'll read about exactly how they do that sensitivity report. Towards the end of the chapter, read about how are some anti-infective agents given prophylactically. And there are some cases, I'm going to say 3 cases specifically, where it is acceptable and good practice to actually give a medication prophylactically. And one I'm going to throw out there is if you're traveling to a country that's known for malaria, your doctor might give you a course of anti-malarial medication. That makes sense because they don't want to wait for you to come down with malaria. Towards the end of the chapter, there's a big discussion about adverse reactions of all anti-infectives. Basically, it's broken down. The 3 main categories are nephrotoxic. It will knock out your kidney function. Improper use of antibiotics, or sometimes even the proper use of antibiotics, can throw a patient into acute renal failure. So nephrotoxicity, GI toxicity, the gastrointestinal tract toxicity, and that's why nausea and vomiting is probably the most common side effect of antibiotic use. And then neurotoxicity, the toxicity on the neurological system. You'll read in some medications, this medication can cause the patient to lose their hearing. So please do read about the adverse reactions in this chapter 8, towards the end of this chapter 8. And again, you're going to look at the key points. You're going to look at the chapter summary and then do those questions at the end of each chapter to test your knowledge. Moving on to chapter 9, which is, like I say, the meat and potatoes, talking about antibiotics. I'm going to give you there's many classes here, don't get overwhelmed. I'm going to give you 1 drug per class that I would like you to look up the drug profile in the Lippincott Advisor, maybe make flashcards or make yourself a table where you have the drug, the class, the indications, the adverse reactions, and then focus on patient teaching, because that's what many of your test questions, if you haven't figured that out by now, many of your test questions have to do with how you teach the patient to take these medications safely. And then when you get into this chapter, you're also going to realize that many of these medications are given intravenously. And so there's a whole nother layer of complex interactions. For instance, does the antibiotic in the piggyback, is it compatible with the actual solution that's running through the main IV? So there's a whole nother layer of nursing precautions that we have to take when we're giving things intravenously. What is the rate of administration? You'll see that with some drugs, if they're given too quickly, vancomycin, for instance, it can, keep reading about it. I have asked you to look up Vanco for the previous chapter, vancomycin. I do want you to look that one up. It can cause cardiac arrest if it's given too quickly. So you understand how looking up drugs, at being educated yourself, it's going to cause you to practice safely and could save the patient's life. But you'll see in a clinical setting, that doesn't come in the doctor's orders. The doctor simply says, give 1 gram of Vanco every 12 hours or whatever. It's up to the nurse to look the drug up, to use the resources that are available in the hospital or through the pharmacist. You can always call the clinical pharmacist when you have questions about compatibility or rate of administration. And I tell you that pharmacist is going to look it up too before they give you the answer. Those fine points of safe medication administration do not come through in the doctor's orders. So that is part of nursing practice. So I want you to look up Vanco, as I mentioned. For the cephalosporins, I want you to look up cefazolin, C-E-F-A-Z-O-L-I-N. And I don't think this is listed in your book, but you will find it in the Lippincott Advisor. Cefazolin, Ancef. It's very popular. It's very popular. It's the go-to antibiotic for pre-op patients, for instance. For the fluoroquinolones, look up the drug ciprofloxacin. Cipro, you've heard of Cipro. That's an oral medication as well as an IV medication. Ciprofloxacin, that's C-I-P-R-O-F-L-O-X-I-N, ciprofloxacin. For the penicillins, I want to say we don't use penicillins that often. Penicillins were the very first class of antibiotics back in the 1950s. But we still do use, for instance, Pen-V or penicillin V, the letter V, we give IM injections of that for patients with venereal disease, for instance. So look up penicillin V. For the tetracyclines, just look up the drug tetracycline. That'll be easy enough. For some of the newer medications, the lincosamides, look up clindamycin, C-L-I-N-D-A-M-Y-C-I-N, clindamycin. And for the last group, for the macrolides, look up erythromycin. So there's some groups that I haven't mentioned, but this is a good representation of at least one group from one medication from many of the groups that we do see used in the hospital. So you'll be able to relate them to clinical practice. That's Chapter 9. There's a lot in Chapter 9, so please pay attention, especially to the patient teaching. I mean, you'll see things like how important it is to instruct the patient to take the full course. Back to Chapter 8, where it talks about how resistance develops. Sometimes that is because of user error. A patient is given a course, let's say a 7-day course of antibiotics. By day 3, their symptoms are gone. I'm going to put these on the shelf and I'm going to save them for the next time I have this urinary tract infection. And then they can actually end up in the hospital when they develop a super infection. So correct, proper use of the medications is really important for us to be teaching. Chapter 10 is the antivirals. So there are many different kinds of viruses that are discussed in this chapter, as well as classifications of antiviral medications. The only ones I'm going to ask you to look up are for a very common class of virus, which is the flu, influenza, and respiratory viruses. Look up the drug Rimanadine, R-I-M-A-N-T-A-D-I-N-E, Rimanadine. That's on your list of drugs in the front of the chapter, but I'm saying I would like you to go to the Lippincott Advisor to look up the profile. And also for herpes, which is another common viral infection, acyclovir. Look up acyclovir. Chapter 11, the antifungals. There's 2 medications. So fungal infections can be very, very serious. In Arizona, our most prevalent fungal infection, I would say, would be valley fever. Fluconazole, F-L-U-C-O-N-A-Z-O-L, fluconazole or diflucan, same medication that is prescribed for that. So that's one I want you to look up because you will run into that. Also, look up amphotericin, A-M-P-H-O-T-E-R-I-C-I-N, amphotericin B. Look up amphotericin B. And then lastly, look up nystatin, N-Y-S-T-A-T-I-N. So nystatin is commonly given for fungal infections that develop in the mouth or sometimes in the vaginal area. A fungal infection can, even when all medications are being taken properly in a hospital setting, let's say, a patient can still develop a fungal infection. And this is an example of a superinfection where the antibiotic that we're giving, it possibly is not that specific, and we are knocking out, or we're at least messing up the patient's normal flora, especially in the GI tract. And, the development of Clostridium difficile is a great example of that as well, where the normal flora of the GI tract is knocked out, and then that C. diff is allowed to grow into a superinfection. But a fungal infection is where the mucosa of the mouth and throat possibly are just wiped away, and the patient can't eat or drink, and they're in intense pain. And so nystatin is a medication that be given in that circumstance. Chapter 12 is the antiprotozoal agents, protozoa, and this is where the anti-malarial medication might come in. And really, that's the only one I'm going to have you look up, which is chloroquine. It's chloroquine, chloroquine. And I believe Plaquenil is a version of chloroquine, but if you look it up, you'll find it under that chloroquine. Funny story. So when you are going to go into the nursing program and going to be giving, as a student nurse, you're going to be giving medications to patients, you're always going to be given, even LPNs, you're always going to be giving medications either with your instructor or with a nurse, because when you're in that student nurse role, you must be supervised when it comes to medication administration. So that's no problem, because as an instructor, we love to be there because it's a chance for us to, for the student to demonstrate that they have good, safe technique and that they know how to look medications up. So I'm coming off the elevator and a student is all excited to see me. Oh, can you give meds with me? And I'm like, yes, sure, I can do that. I said, have you looked up your meds? Oh, yes, I've looked them up. So that's all I needed to know. I didn't need to quiz him or anything like that. Like, okay, you tell me you looked them up. So we go into the room and he goes, Mr. Smith, the first medication I have here for you is Plaquenil. It's your anti-malarial medication. And I'm like, what? What did you just say? Like, how many malaria patients have you seen in Mesa, Arizona? None. So if you keep reading, this was an example of when a student does the least amount of work possible, that because they're going to try to save time. Keep reading when you look up this drug. Keep reading. Yes, it is an antimalarial. Keep reading. It's also used to treat some kinds of, like in this instance, the patient had rheumatoid arthritis. And even if it's an off-label use, you're still going to be able to read about it in the profile. It'll still have that off-label use in the profile. And indeed, had the student looked at the patient's drug profile, he would have seen that this is a home medication that the patient has taken for several years for his rheumatoid arthritis. And it would have been much more appropriate for him to say, this is your rheumatoid arthritis medication, the same medication that you take at home, versus give the patient a little mini heart attack when he's telling him that he possibly has malaria. So don't do that. Don't just read the first line when you look things up. Keep reading and make sure it makes sense to you. Like, why didn't that student say, why am I giving this patient a malarial medication? This is an example of non-critical thinking. This is an example of being a robot nurse. She told me to look it up. It says it's for malaria. Okay, here's your malaria medication. That just doesn't make sense. You need to stop and ask questions and think about that. That is the one medication I want you to look up for protozoal. And then you'll see there's a table that mentions different kinds of, like, how do you get a protozoal infection anyway? You can drink water on a camping trip from a stream that has certain things in it, parasites and such. There's also a superinfection, Pneumocystis carinii, which is associated with AIDS. You can skip over the chapter 13, which is about worms, and lots of medications that are effective against certain kinds of worms. You can look those medications up. Chapter 14 is anti-neoplastic medications. Basically, these are chemo medications. I'm telling you that as a new grad nurse, you will not be giving chemotherapy agents. You're required to have an oncology certification in order to give those agents, and depending on what hospital you're in, sometimes that course can take between 6 and 12 months before you're allowed to give agents. If you have a patient on your floor that's receiving a chemotherapy med as part of their regime, let's say they're on chemotherapy and they're in the hospital for an appendectomy or something, or a gallbladder surgery, you'll call the oncology unit, and a chemo nurse will come down and administer that medication to your patient. There are 3 meds I want you to look up here just so you understand how they work. But in general, you won't be responsible for giving chemo meds. But the 3 meds I do want you to look up are methotrexate, methotrexate, vincristine, 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 and then tamoxifen. Tamoxifen is very popular for patients who have had certain kinds of breast cancer or who have undergone breast cancer surgery. Tamoxifen. So I want you to look that up. That's TAM. And that is all we have for this week. If this seems incredibly easy to you and you've got lots of spare time, there is a VSIM that's due next week. You could look at your schedule, work ahead onto that if you like. Other than that, if you have any questions, please drop me an email, and have a good week 7.